and poor diet calcium. Oh, by the way, you have to know all the food that have a lot of calcium, okay? Milk, your cheese, rhubarb, and collard green. Let me special type something for you, okay? Please, 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 calcium diet, mandatory. And then careful, dairy product and non-dairy. So read carefully in NCLEX, they trick you because they can ask you which one is calcium diet but dairy product and which one is calcium diet but non-dairy product, right? And usually the answer for calcium that dairy, this is the one that milk and cheese, whatever that dairy product, right? Cheese. And then the one that non-dairy, somehow they love this answer, rhubarb and collard green. And you please Google some more. Please make a card for yourself, right? This is pharm. So you should already make a card, make a card, many cards, right? This is all my diet that potassium. This is all my diet that iron. This is all my diet for calcium. You should have something like that. This is all my NSAID. This is all my thrombolytic. This is all my anticoagulant. This is all my antiplatelet. Do you have something like that?
Miss Ina, what's yogurt?
Yogurt is also your dairy product. Answer my question. Do you already have the card?
No.
No, ma'am.
Please start make that. Okay? Please start make that. It will be really benefit for you. Especially in clinical, actually the teacher should encourage you to make the card. Okay? So you should have card. This is my antiplatelet. This is my anticoagulant. So you know really the difference. Because some students, you still really confused. You tangle everywhere like Alzheimer. You tangle in your brain. And that's why all your information like that, they all mess up because you just throw them all together. It's like you throw away all your clothes inside the washing machine and then you just blend, right? And everything together and mix together. Okay? So Google some more what is my dairy product and what is my non-dairy product. Guarantee you will see question like that. They love diet question. Who is your teacher for diet?
Miss A, what's nutrition?
Oh, nutrition
Miss
is
Joyce.
not
Miss Joyce.
not Miss
Are you
Vicky.
right? Miss Joyce.
Okay.
Miss Joyce.
So hopefully you remember all that diet lecture because it's important. Many questions about diet. All right, and then there you go. I mentioned this, very important. Sit upright, 30 minutes. This is your test question, ATI question, always about this. Okay, and make sure you remember your alendronate, all those. Okay, so the first thing in the morning, please wake up. This is what you have to know. Don't tell me you don't know what to study. So in the morning, before breakfast, right, before you take other drug, to prevent drug interaction. Please, this is what you have to know. Okay? And then sit upright. This is your ATI question. This is your test question. Why? Because I don't want esophageal irritation or reflux. I don't want irritation to my GI. Alright? And then remind them dental exam. So it can problem to their teeth. Right, every 6 months, because the teeth is the place where you have your calcium and you have your phosphate, right? And why you need to go to dental? Remember, because I'm afraid with your jaw bone osteonecrosis, so I don't want it affect your jaw. I don't know why it affect the bone at the jaw, right? With this biphosphonate. Every time you see this name, I hope you remember this is your osteoporosis medication. Okay? And then if you give IV, it's always slowly over 15 to 30 minutes because you don't want cardiac complication. So this slide is very, very, very important. Make sure you read and memorize. Any question? Okay? And then the rest, read by yourself. But the most important stuff I already cover for you. I already talked about that. Any question? 10:58. Let me call Rob.